Without Cass, where's everybody gonna go?
You're broken down and tired of living life on the merry-go-round.
Me right now, I actually would probably be on the corner homeless.
See it in you, so we gon' walk it out. Move mountains. We gon' walk it out and move mountains. And I'll rise up, I'll rise like the day. I'll rise up, I'll rise unafraid. I'll rise up, and I do it 1,000 times again. And I'll rise up, I like the waves. I'll rise up, in spite of the ache. I'll rise up, and I do it.
I'd definitely be on the street if it wasn't for Cass.
The silence isn't quiet, and it feels like it's getting hard to breathe. And I know you feel like dying, but I promise we'll take the world to its feet. Move mountains, bring it to its feet. Move mountains, and I'll rise up, I'll rise like the day. I'll rise up, I'll rise unafraid. I'll rise up, and I do it 1,000 times again. All we need is hope, and for that we have each other.
If they come here and want their life on track, this is the best way to get started.
We will rise, we will rise, we'll rise. Oh, we'll rise. I'll rise up, rise like the day. I'll rise up, in spite of the ache. I will rise 1,000 times again. And we'll rise up, I like the waves. We'll rise.
There's no better place. They give you what you need, and the case managers are so caring.
Do it 1,000 times again.
Hello from sunny Phoenix. My name is Lisa Glow. I'm the Chief Executive Officer for Central Arizona Shelter Services. I've been in this role now for 3 years, and it has been an amazing roller coaster ride, probably one of the best jobs I've ever had in my life. My background is in law. I became a lawyer in my 20s, practiced for a short while, realized what I really loved was community work. I then went to work for former Governor Janet Napolitano. I was with her for about 7.5 years, and that's where I really learned about policy, state budgets, politics, and how much you can get done on the government side. So advocacy is a big part of what we do here at CAST. It's part of our DNA, has been for 35 years. After working with Napolitano, I went to run a nonprofit and realized that that was more of my forte. that I wasn't going back to law. And then for 9 years after that nonprofit, I consulted. My specialty was in fundraising, building the infrastructure of nonprofits, program development, and helping them get to a new level of delivery of services. 3 years ago, I was recruited for this job, and it really seemed like the perfect fit because homelessness is political. People are suffering, and there's a lot of fear and poverty, and the politics cannot be understated around what we're dealing with in this arena. And that'll be part of my presentation. Public policy is critical, and fundraising, of course. If you're a nonprofit CEO, you have to know how to fundraise. And during COVID, we've had a lot of challenges, but a lot of opportunity. So today I'm going to be talking about our agency, Central Arizona Shelter Services, located here in Phoenix, Arizona, and the lessons from COVID and a pathway ahead, and where I think we can go next to really take advantage of a terrible situation, a crisis. Never waste a crisis is going to be my fourth lesson for you. Looking forward to meeting you all, and I will look forward to taking questions from you since this is pre-recorded at a future time, and we'll provide my information at the end. Thank you. So for 35 years, CAS has been leading the charge to end homelessness. As I said, we're going to talk about lessons from COVID-19 and the pathway ahead. Next slide. We celebrated 35 years this year. CAS came about because we had a homeless crisis in the greater Phoenix area. It was such a significant crisis that we made national news in Newsweek, and not in a good way. The city without a heart is what we were called. Our mayor at the time, he was a brand new mayor, decided something needed to be done. The firefighters and other community leaders got together and they decided to create a nonprofit, which they called CAS. We opened our doors in downtown Phoenix in 1984. And at that time, we were serving both adults and families in a 2-story shelter down here on Madison Avenue. Now, 15 years ago, the Human Services Campus was founded. CAS was one of the co-founders of that. And so 15 years ago, our adult shelter moved to the Human Services Campus, which is a collaboration of partners that have medical and dental and behavioral health and food and all kinds of services. Our adult shelter is 470 beds at the Human Services Campus. Our family shelter is now located in North Phoenix, about 100 beds. And recently in June, we opened a COVID-19 hotel accommodation for seniors. I'll talk about that later. We currently have 65 seniors. We should have more soon if the city of Phoenix is going to vote in favor this week for that, and we'll have more soon. We also provide rapid rehousing and other services as well. Next slide. This is what our downtown facility looks like. Our mission, to prevent and end homelessness among individuals and families while advancing compassionate community solutions. I wanted to share that because we redid our mission this year. We added prevention to the title, and it was a significant conversation for us because we know we need to do more at the front end to prevent homelessness because it is rapidly on the rise, especially here in Maricopa County. While advancing compassionate community solutions, that is to reflect that we believe we must work together to advocate for community solutions. It's not enough to just provide services. We've got to be at the forefront of our thinking in advancing new solutions. Our vision, a community where everyone has a home, average served 5,600. Next slide. We have a lot more data. I'm not going to be sharing it with you, but happy to share it later. I really want to get into the lessons from COVID. Lesson 1, homeless emergency response systems. That's what we do as an emergency shelter. And I'm going to talk about the good, the bad, and the urgent that came out of COVID. Lesson 2, the congregate shelter response. Lesson 3, serving the most vulnerable during the pandemic. And lesson 4, never waste a crisis. Next slide. First, I will be talking about some of the good that happened. Well, luckily, as an emergency provider, we could quickly adapt using our expertise. We started by shoring up our mission, saying our first priority has to be safety keeping people safe. We had a daily phone call for months at 4 p.m. among all of our team. We had a new chief operating officer who'd been with us for 3 weeks, and she quickly took this on. And it was remarkable to watch what happened from that. Policies and procedures were put in place quickly. We were working with public health, top priority, and working with partners, and I'll talk about that later. The second part of our shored up mission was to shore up all of our housing programs because we wanted to get people housed as quickly as possible. Communication, absolutely critical, and failing quickly was another part of that quick adaptation. And there were a lot of conversations about, let's try to get this hotel, and do we have enough money to do that? Back in March, we didn't get our hotel until June. So we had to think philosophically, how are we going to get through this? How do we adapt quickly? Collaboration, secondly, was critical. Working with the Human Services Campus, working with public health, and working with a health provider called Circle the City, we were able to coordinate on an 8:30 a.m. daily call led by the Human Services Campus to figure out what to do. We had disagreements. We came together around common issues, and that call still happens now. It was happening on weekends. It's only 5 days a week, that 8:30 call. And the coordination is pretty remarkable. So someone who may test positive, and weekly testing is happening here, would quickly go to a hotel that's being run by Circle the City for people who are COVID positive. We had many new partners emerge from this, United Healthcare being one of them. I won't go into all of the details on that. It's a whole nother lesson in itself. Also a forward-thinking solution, but they're helping us get people housed. That did not happen before. The CARES Act and other funding, as most of you probably know, provided some critical resources. Our concern in the future is when those resources go away, how do we continue to carry on what I believe is a more appropriate level of services for people in need? We created new programs at CAS, including an indoor program. So with 470 people in the past, people would go and get other services during the daytime. Our most vulnerable now stay indoors at CAS, and we're doing new programming based on what those clients want. We surveyed them. So that's a positive outcome. Similarly, in the community, new programs were created. The City of Phoenix created a homeless plan and a housing plan that you can take a look at on their website. There's a lot of lessons out of that and a lot to be coming in the future. And we shored up our systems lastly. This is a really exciting thing for us. We were able to get a new field in HMIS to collect insurance data. And I don't know if you have that in your community, but it's taken a long time. It was a conversation for 2 years, and we just got it done because we were tired of waiting. If we were going to be able to work with United Healthcare and Mercy Care and others and get them client information, we needed to collect it. And then we developed a new screening tool for seniors. Next slide. The bad, insufficient shelter beds and lack of affordable housing. Our point in time in January for Maricopa County identified 7,419 people as homeless. The real crisis is in the unsheltered. 51% are unsheltered. We do not have enough beds. And we've had unsheltered numbers rising throughout the entire valley. In the West Valley of Phoenix, 219% rise. In the East Valley, there's cities, it's not of Phoenix, but there are different cities. In the East Valley, 129% increase and not enough shelter beds. People do not all want to come to our shelter, plus we don't have enough capacity, so we need more beds. We have seen in our point in time, increased number of youth, seniors, and veterans became homeless, but family homelessness declined. Next slide. The urgent is our next slide. Maricopa County holds 70% of the state's homeless population. We've seen a dramatic rise in street deaths this year. We have the highest eviction rates in the nation during the pandemic, and we had the second highest before the pandemic. Our researchers at the University of Arizona project a 30% rise in homelessness and COVID exposed weaknesses in our system that need to be addressed. These are urgent, but while we're dealing with the crisis, we're not going to get to address all of these. But the reason I put this slide here, policymakers and leaders need to know how urgent this is, and we have to raise our voices. Next slide. Lesson 2, our congregate shelter response. I mentioned a little bit about this, safety first, relying heavily on CDC, USICH, and local public health guidance, and that those were ongoing communications. We had to implement also social distancing and reduce the numbers at our adult shelters. So we're currently capped at 400. Challenges, I will say the number one biggest challenge has been staffing. We had a staff of about 68 before COVID. We now have 100, and we have open positions. So when you get new funding to do things, that means you've got to hire staff. We had some staff who left who were afraid of working. So we had long-term staff leave. It was problematic. Contact tracing, we had to do it ourselves. We're still continuing to do it. So we had to learn how to do that. Program changes, weekly testing, cleaning and sanitizing, probably similar things to what most of you have seen, but a lot of lessons just from those challenges. At one point within our adult shelter, we had to do a quarantine shelter. That was a huge challenge, but we did it, and public health helped us out. People didn't necessarily want to stay indoors. It was in one of our large dorm areas where about 100 men were quarantined. And challenging to ramp up our housing programs, but we had the funding. So again, staffing. The last point on here that I want to pause on for a minute is a flexible financial assistance and prevention program that we created at CAS in 2017. It was created by frontline staff because they recognize rapid rehousing is not enough. There are a lot of people who don't qualify who need one-time assistance, and we can quickly help them end their homelessness. In fact, since 2017, we've helped 1,237 people at an average of $500 per person with this one-time assistance. And what it looks like is they get one-time deposit assistance, one-time travel assistance. We've even done eviction prevention. Now, when COVID hit, we didn't have a lot of funding in the program, and we've been able to raise private dollars for it. And we've always had to allocate, okay, we only have 3,000 this month. How many people can we help? What I instructed our program team to do when we got some funding secured, caps are off. If you have people who qualify, we do not want a waiting list, just help who you can. And so one grant we got for $60,000, we spent it really quickly and got a lot of people housed in a bad housing market quickly with that one-time assistance. Next slide. Lesson 3, go back to lesson 3, which is serving our most vulnerable. So CAS has made serving senior citizens a high priority since I started here 3 years ago, and we saw our numbers rising. 30% of the homeless population now are over the age of 55. The projections by national researchers are that we will see a tripling of the 65 plus population by 2030. And in March, we had 184 of our 470 adults over the age of 55. Most had health issues and disabling conditions. So of course we were extremely worried. So we talked to our partners, we talked to the county, the city, of course the campus that we're on, United Healthcare and others. And what happened from there was some smaller hotel shelters started to open up. Some were run by other nonprofits. The Human Services campus took a part of the campus and had a 40-bed smaller shelter so we could get 40 of those 184 out. But we kept on marching forward because we knew these were the most vulnerable. So in June, with money from the City of Phoenix, CARES Act funding, we got a hotel. Project Haven Hotel is what we call it. The remarkable thing about this is it's within a hotel that is still serving other people. And nobody in the neighborhood even knows we're there. That was important because we didn't want to have people fighting us getting in there. And it's a nice hotel. It's for people 60 and the medically vulnerable. So if you're over age 60, so there could be someone who's 50 who has HIV/AIDS, and that person would qualify. There could be someone in their 40s dying of cancer, and that person would qualify. And those are a lot of the real clients we've been serving. The services at Project Haven are more intensive than at our adult shelter. 1 to 15 case management ratios, intensive housing services, including with partners like United Healthcare and new behavioral health partners who have housing resources. So putting this together in a new model to better meet the needs of the seniors is what we did. To date, we've served 124 people, 34 have been housed, 44% enrolled in behavioral health. If you want to learn more about this model, I'd be happy to talk to you further and tell you about it. Now, in March, I'm going to hold up a newspaper. I don't know if you'll be able to see it, but we'll send a copy of this. The Silver Tsunami of the Homeless, the front page of the Arizona Republic. I'll hold this up after because I don't think you can see it right now. The front page of the Arizona Republic had an article, Silver Tsunami of the Homeless. Cass had been working for 2 years at our state legislature to get an appropriation to open a shelter for senior citizens in the West Valley. And remember the slide where I showed you we've had a dramatic rise in unsheltered in the West Valley? Well, we worked with our political leaders in the West Valley to make this happen. This bill was with bipartisan support, sponsored by Senator David Livingston, a conservative Republican. This was a totally bipartisan effort. It was remarkable. And we had the appropriation moving forward, had this front page article, had the political will. March 11th, March 12th, our state shuts down and all budget bills are pulled at the legislature. So we did not get the funding. We'd worked the year before on it and we didn't get the funding the year before, even though there was some money put into the budget. We're still going to keep going forward to get this senior shelter. The political support is there. We have been working on building our programming for seniors for 3 years now. We have a team that works with our most vulnerable seniors. We have new screening tools, and we're going to continue this effort. And I bring this up to all of you because I think it's an opportunity for us to serve a vulnerable population, to get into communities and take care of that 30% of the population in a new way. Next slide. So, never waste a crisis. Emerging opportunity and innovation. I think when we have a crisis, it's the perfect time to challenge assumptions and make things happen. We've got CARES Act funding. We have places around the country looking at opening hotels. We have temporary places open now that we should try to make permanent as well. It's also a good time to talk about new shelter and housing models. We need to put them forth and act upon them. One of the things we did about a month ago, and it was a grant with a partner to purchase a hotel through United Healthcare. They have Home Matters grants, and I think they're across the country. If not, I think they will be coming across the country in the near future. Our grant scored very high, but they decided they would not award any $1 million grants at that time. They told us to apply next time. If we had gotten that, we would have purchased a hotel, renovated it, and it would have been for transitional and permanent housing with behavioral health wraparound. So we're building all of these new models. We just need to get the funding and build the political will in communities. The third bullet here, I believe we need greater flexibility in housing resources. That needs to continue. COVID has given us that. We get money from the Emergency Food and Shelter Program, and there was more flexibility built into some of those COVID dollars so that we could help people with eviction prevention. We've done about 100 eviction preventions. That's not our core business, but with the flexibility, we see it as there's no wrong door. Let's help people when they are finding us. Let's do what we can within the terms of our programs. And I think in the future, we need to demand more flexibility in housing resources from our big funders, government especially. Fourth bullet, more services tied to housing first are needed. Well, this is something we believed before the pandemic. We still believe that we need more follow-up resources. We need more resources when you put someone into a housing first program for them to succeed. I think far too many people fall out of the program because they don't have the right level of support. Fifth bullet, greater focus on prevention at all systems level. Diversion is a critical piece of keeping people out of the system. What we're doing once they're in the system and in our shelters, we consider prevention, our financial assistance program, maybe it's a secondary prevention. I think we need to create the conversation to figure this out. More prevention at all levels, because we are facing a big eviction crisis. Next, smaller shelters and specialized services. There's a lot of conversation here in Phoenix, including in the city of Phoenix's homeless plan. The senior shelter model that I talked about would have been smaller and specialized for them, and we're still going to continue to pursue that. We're going to go to the legislature again this year, but we've got some other things that we're working on as well. Right now, there are CARES Act funds that are being used in some communities to purchase hotels. We tried to buy one, but then the city council decided they didn't want us in that community, but we're still working on it, other communities. These smaller shelter models that I would envision, and this is from listening to the needs of people and what our staff say, people with disabilities, people with serious mental illness, seniors, youth. Now, some of these things exist, but not on a scalable level. And throughout our county, with 51% being unsheltered and with huge regions of the county not having any shelter, I believe this is the way to go. It's going to take political will. The only way we're going to get it done is we must build the political will and help communities overcome fear. That's a whole conversation in itself. I feel like we have to learn from each other where we can to do this. Part of what CAS has been doing for 35 years is we've had strong relationships with our cities and municipalities, and we need to continue with that. So the conversation around seniors is one where it's a benign population. And that's why we think it's a real place to start to open more of these specialized shelters. Next slide. Go back to the last slide. I forgot to talk about one thing. And when I talk about new homeless solutions, we just received a grant to form an alliance with other providers. And what we're going to do with that is it's for 1 year. We want to build our collective advocacy so we can have more of an impact at our legislature. Our state does not put very much money into our homeless services line item. Some states put a lot. Ours, I want to say it's about 5 million. This is the year for us to go forward collectively and try to increase that line item. I have no doubt about that. So our new Homeless Solutions Alliance will be with providers. There are cities who will join it. We have facilitators we're going to be hiring. We'll form our charter and work, of course, with our state advocacy group, the Housing Coalition. But this is very targeted right now on homelessness. And we're going to pick 2 or 3 things that we can do together. So if you want to learn more about that, we'll be developing our charter in December and are happy to share what we do. And we'd also like to learn from you if you're doing this. Okay, next. So what do we want to say was achieved at the end of the crisis? We want to be able to say we protected people and did our part to minimize community spread, that we moved thousands of vulnerable people to permanent housing, maybe hundreds would be more appropriate because we don't have enough affordable housing, but it's aspirational, that we created and demonstrated new shelter housing models, and that we converted one-time opportunities into permanent funding for operations, new beds, and housing. CARES Act money is still available, and there should be another bill that gives us additional. But if we don't have the political buy-in and neighborhood buy-in to convert some of these temporary locations into permanent shelter, it's not going to happen. I would like to be able to say we overcame neighborhood and community objections to creating more shelter and housing. I want to be able to say we implemented meaningful racial equity and social justice initiatives. We are going to be interviewing someone to come on part-time for, I think the title is going to be Equity and Social Justices Director, something like that. And it is a priority right now with a lot of the funding community, and with the inequities that exist and disproportionate representation of people of color, we think we've got to make this a priority. I want to be able to say we improved our systems, including crisis response, data, and reporting. And lastly, that we built strong and lasting partnerships. One of the other things I forgot to mention we created during this is a new database system called MyCast that's going to help us better pull out data. It's still in development. We use HMIS, but there are some limitations. So we hired someone to help us with this. And we are also on the pathway to becoming a Medicaid provider. Remarkably, we don't have that right now, and we should. Okay, last slide, I think, is for questions. Go ahead, and let's thank you for your time today. I'm gonna wrap it up here in just a minute. I have one more document I'm going to show you called Senior Housing Solutions, Paths to Ending Senior Homelessness. I mentioned how we were at the state legislature, and you can see in the column here, Senate Bill 1283 in the second column is what we were pursuing this session, but then COVID stopped all budget bills. When we were lobbying at the legislature, we heard folks asking, so great, you get them into some sort of a bridge shelter, then what do you do afterwards? Well, we all know we have an affordable housing crisis. Maricopa County is particularly problematic, and our rents are rising and people are being evicted, as I mentioned. So we put together this document. It's a work in progress, and I just wanted to share it with you because this is how I believe we need to start thinking. What are from prevention to other alternatives? And when we start our alliance work, we'll share this with folks. We've shared it with others. As we look forward, how do we start thinking about new solutions now? And on here, building more affordable housing is one piece of it. But some of the things that I think we need to look at, intermediate services, if you look in that, like neighborhood integration, there are models that are working where people are in neighborhoods and nobody knows they're there. There are low-income rentals, transitioning in place, scattered site programs, roommate sharing. Our area agency on agency does Age Connect. But are we tapped in enough to really take advantage of all of these? I would say we're probably not, if we don't know about them. And then what can we do together to scale up things that are working? So that intermediate services, for me, given we're in a crisis, is where I think we could get really creative. So we'll share this document with you as well. And again, it's a draft, a work in progress. So thank you. So thank you everyone so much for your time today. I really enjoyed this opportunity. Putting this together helped me also think about what we want to achieve next year. Taking the time to think strategically when we are all so busy is so critically important. So thank you for the opportunity. I'll share my cell phone and my email for any of you who might want to connect further. I look forward to learning from all of you as well. Enjoy your conference. Thank you.